was your approach in your disclosure in both, I guess, your medical school applications and your ERAS applications? And did that come up first thing in interviews, or is that something that you discussed in your personal statement?
Yeah, so my wheelchair is really obvious. I couldn't hide it if I wanted to. And not all disabilities are like that. So I was very open about it. And I felt like if a school or a program was going to take me, they had to take all of me, right? One of the reasons I really wanted to become a physician is because of my experience as a patient with a disability. So, yeah, I was honest about it in my personal statement, both for medical school and in residency. It also taught me how to be really creative in difficult situations, which is a much needed skill in medicine. So, yes, I did write about it. And I think that actually helped me, especially in residency, get into a program that was really supportive.
Great. How did programs respond to your story and both during the interviews and in your follow-up communications? Were there any standout positive or negative interactions that you had on your interview journey?
For medical school, I didn't get invited for an interview everywhere. But the places that I did, I would talk about it. For residency, I actually had a little bit more, I guess, confidence to say, like, hey, obviously I'm sitting in this wheelchair, but I've managed medical school, just fine. I know that there may be some challenges, going into residency, but this is how I'm prepared to deal with them. I was looking for residency programs that were big, so I wasn't like one of just a few residents, there would be a lot of us, and B, in like metropolitan areas that would be accessible. I brought it up when I needed to, but ultimately it came down to planning once I matched and got into a program. For the program, I ended up going to Montefiore Medical Center in the Bronx. It's the residency program in social medicine. They were awesome. They reached out to me. Like, I got a call on match day, like, hey, we're so happy you're coming. Messages from the program director so that we could start planning ahead of time and not wait till the last minute.
Was there anything that the program had in place in processes they've done for other residents who had similar disabilities, or maybe they just had that system in place? Or was that something that you felt that you had to educate them on as things cropped up?
I don't think they had someone in a wheelchair before. And then I also use hearing aids, so that's challenging. But I felt very welcome to be able to educate them and tell them what I needed.
Mm.
And I just had really good support from my co-residents. But I don't remember that there was something specific in place. But whatever I needed, we figured it out some way.
Okay, great. A doctor with disability, and for all the students in the room who are potentially thinking of applying to residencies and are not sure about how to go about picking programs or what criteria they should use when selecting these kinds of programs, what advice do you have for any applicants who are navigating eras with visible or invisible disabilities, especially around being honest and advocating for themselves and finding those supportive programs?
That's a really good question. So disclosure is a very big thing. Not all disabilities are visible, and it can be really hard to have to disclose what disability you have to someone. And then, there's the phases. So like you're applying and then you want to get in, and then once you get in. But remember that there are laws to protect. I would go to a program where you mesh well with the people and maybe ask or look on the website, like what do they do to support residents with disabilities? Because I can tell you from experience, it can be done. It can be done, right? And so I don't think you have to disclose a disability. I honestly don't. I think that's a personal choice. That's up to you. But know that unfortunately in medicine, the way the culture is, you may have challenges if you end up somewhere that either doesn't have experience with it or they're not open to helping you. Because I can tell you, like in medical school, when I had pushback from one of the deans when I was going into third year, I actually had to get a lawyer. I had to get a disability rights lawyer. Also, like to get accommodations, even on my step exams from the NBME. I had to fight and appeal and get a lawyer to help me with that. with or without a disability, the best advice I can give you about residency, because it's hard no matter where you go to a place where the people are like-minded, the people care about the things that you care about, and their mission is in line with what you want to do as a doctor.
Thank you for that. And I feel like that's a great place to end. Is there any last messages or takeaways you'd want to share with any medical school students about disability inclusion in medicine as a final little send-off?
So what I want to say is that we need you in medicine. We do. And in my story, it was always like, oh, disability, you have to fix it or accommodate it, or are you going to be a risk to patients? Can you do this? Technical standards, blah, blah, blah. No one ever in my entire journey thought that my disability could actually enhance my ability to be a good physician. So we need you in medicine. We need your expertise. You are talented. You are worthy. Don't let anyone tell you otherwise. There are ways around doing things like technical standard. And so don't let people tell you otherwise, because we need you. We need you in medicine. We do. And the patients, I can tell you now as an attending, appreciate that, like, my tables are high adjustable tables. So, making an accommodation for me to help to be able to see my patients actually helps future patients with disabilities have accessibility when they come to the exam room, right? And you definitely have a perspective that not all medical students have, that we need in medicine. We need to make it better.